Scotland really does have a long and very proud tradition of people coming together to use energy and creativity to make a difference to their communities. It was, after all, in that the roots of our National Health Service were born originally in the fields of municipal socialism at the turn of the century. And we all know that communities can do great things when they are able to achieve their own goals, when they have the freedom to choose their own path and take responsibility for their surroundings, being trusted to take their own decisions about them. Democracy very often is seen as being about parliaments and councils and governments, but first and foremost, everything that democratic government has to do is about people and the communities they form. When launching our programme for government, the First Minister described that fostering a sense of participation is about more than just consulting. It's also about being brave and handing some direct decision-making powers back to communities. And what is a community? Well, there are two types that we recognise in the Community Empowerment Bill and in the approach we take. The community of area, where the people living in one place form a community, but also the community of interest, where people sharing the same characteristic or background are recognised as a community. In health in particular, there are fairly obvious communities of interest when it comes to the sufferers of any particular condition. And it is absolutely essential that we recognise the talents that exist in those communities in both shapes and support people in them to achieve what is important to them. And I would like to use this time to focus on why empowering communities, not just consulting or engaging with them, will help shape the design and delivery of better services for the people of Scotland. And this is as true in health and social care as it is in any field of government. Now, consultation is too often one-directional and in response to pre-chosen, pre-developed questions. Empowering communities genuinely requires a much deeper, more meaningful, more early involvement that affords those engaged the opportunity to propose their own views and enables them to shape, as a result, the circumstances of their lives. Communities are often best placed to determine priorities for local services. And public service providers, in turn, have to facilitate those processes so that they can fully allow and support communities to participate in the decisions that are taken about the design and delivery of services to achieve those priorities. Now, community empowerment means different things to different communities. No two communities are exactly alike. No two communities have the same needs, have the same appetite even to take on decision-making. And it wouldn't be real community empowerment if we dictated the shape of that community empowerment very strictly from the centre. Some communities will want to take ownership of buildings, deliver services to members of their own community. Others will just be more interested in having a say in how money is spent. When it comes to that, I've been particularly interested in a process that has come to these shores from abroad, but which has developed a bit of a foothold, and that's participatory budgeting. PB provides a way for local people to have a direct say in how and where public funds can be used to address local needs. It's very often used at the moment within the UK as a method of allocating grants, but the capacity it has to choose priorities and rank priorities is something that we really should be ready to tap in this country, because it can be an important resource to build on the wider development of a participatory, healthy civic democracy. And to this end, we are providing training from the Scottish Government, free training to local authorities to raise awareness of this already now increasingly tried and tested tool for improving community engagement and participation. One of the examples that I've been shown, and unfortunately it happened before my time as a minister, was in Govan Hill, where equally well funding was distributed of over £200,000 based on community priorities and community participation. And all public service providers have a responsibility to create the conditions that encourage the strong, independent, resilient communities that can participate in these processes as well. and this government is clear that community voices must be heard, but people must also be able to participate. And there is an important health dimension to this, because from Aristotle in his Nicomachean Ethics, when he recognised the importance of people being able to express themselves for happiness, up to today, our own Harry Burns talking about the importance of people having a sense of control over their own lives and being able to express themselves in their communities, having an impact on health. That crucial part of human nature has been recognised and valued and recognised as important. Community empowerment, in light of that importance, has to be seen as a public health measure. And as part of this agenda, the Community Empowerment Bill, which is going through Parliament at the moment, will give new rights and opportunities to communities to make that kind of difference. The bill will provide a legal framework to try and break down some of the barriers that there are and empower communities to work in partnership with local service providers and do things for themselves through asset transfer requests and participation requests in particular, two key new mechanisms being introduced. The bill, we aim, will strengthen the voices of communities in the decisions that matter and make sure our public services are focused on doing what those communities care about. Importantly, the bill requires community planning partners and CPPs to both enable the participation of community bodies, but also to contribute resources to secure that participation. And further refinement has put greater emphasis on socioeconomic disadvantage since the bill was first introduced, not just in tackling it, but in ensuring that those who face it in their day-to-day lives can participate in decisions being taken about how to address it. The bill also supports an increase in the pace and scale of public sector reform. We want to improve the process of community planning through community planning partnerships. And in doing this, the bill aims to support approaches that can contribute to improving all aspects of people's lives. Since the bill was introduced last year, the demand for participation and empowerment has grown. The referendum last year demonstrated, if proof were needed, that people get involved where they feel they can make a difference, where their choices will have an impact. And we now need to build on that sense of what can be achieved. The legislation contributes to the growing sense of what we call democratic renewal and change by supporting real initiatives that can contribute to all aspects of people's lives. The bill changes the purpose of community planning as carried out by community planning partnerships to a process that is carried out with our communities to tackle local priorities and to reduce socioeconomic disadvantage for those communities. And the bill emphasises that participation in community planning as in all other parts of government. And this focus on people and their communities is a principle shared by health and social care integration. In fact, health and social care integration is an excellent example of how we can enable people and communities to engage. Health and social care partnerships through their locality arrangements must demonstrate that engagement with local communities in the development and design of health and social care services. And achieving this, well, it's going to require partners to work collaboratively with people in their own communities, sharing their understanding, their knowledge and resources to help just deliver better health and well-being at a community level. And nowhere is this more important than for the most vulnerable people. How public services work together and with communities to provide person-centred support to those individuals and families with the most complex needs is the true test of how effective our services are, but also how effective we are at joining up departments that were once disparate and entrenched and which cannot be allowed to be so anymore. So how do the CPPs link to health and social care integration? Well, both CPPs and the Community Empowerment Bill will act as key enablers to support health and social care integration, because the bill will make integration joint boards a statutory community planning partner with shared responsibility along with all the other community planning partners for identifying and responding to priorities for communities in that local authority area. And there are many good examples now out there of community planning partnerships. But to be a good CPP, you need to demonstrate a strong evidence-based understanding of the community you're dealing with, an understanding of the place, of the people that are involved, the sensitivities, the history. That's a very rich knowledge that can only be developed at the local level. But you also need that collaboration among partners and communities in setting the priorities, designing and delivering the services to meet all of those particular circumstances. We can legislate for many things in the Scottish Parliament, but we can't legislate for local knowledge. We can't legislate for local relationships. We can create the frameworks, but it is down to you to collaborate, to talk to each other, to develop those partnerships that are the only way that services can be delivered if they are to be effective. Each community planning partnership and integration joint board need to decide for themselves how best they can work together. We have to give that space for local understanding, for local resources, local circumstances. The connection between the two, however, are particularly valuable in terms of supporting broader well-being of vulnerable people, also stemming the future demand for integrated health and social care services by preventing or slowing the onset of vulnerability. By working together, it is much easier to target resources at the preventative agenda. And our philosophy ultimately rests on this culture of participation, which is more than simply engaging or consulting people. It is about giving people a sense of control over their own lives, being involved in shaping the design and delivery of services to fit them. And by ensuring we have a stronger focus on tackling inequalities and empowering communities, the bill is a major step in helping to make that vision a reality. It's essential that everyone involved in public service remember that the success, health and well-being of our local communities are central to the strength of Scottish society as a whole. We are almost entirely the sum of our parts. And integration relies on learning from others, and that we all have to embrace openly and proactively, ensuring that lessons are learned across partnerships and bodies. And I would say, as a Minister of National Government, that applies to relations between national government and local government as much as between different statutory agencies working at the local authority level. And we want, though, through all of this, working with all of these partners, everybody who is engaged, to create a culture, frankly, of normality around community empowerment, that it should be the norm and not the exception. And legislation, the establishment of integrated joint boards won't fix everything, but they can help with the creation of that culture. They can provide the space in which that culture can develop and put a renewed focus on improving things together and reducing inequality in our communities. The rest, I have to say, is over to you. And we're going to have a film in a moment, but before we do, because I have to run off because of the slight change in timings, I would be very happy to take any questions or comments from the floor.
Thank you very much, Minister. It's Mary Pitt-Casely from Falkirk Community Planning Partnership. I found that very useful and very interesting, and I think we're all challenged and excited by the provisions of the bill, because I think they do present us with some challenges, and perhaps it would be worth considering to what extent we need to consider upfront the tensions that are often described as inherent tensions between the professionals and the vested interests in some part of this system and genuine community engagement.
Can I just ask, what sort of vested interests are you thinking about? Because the term has been used to describe people in very different places.
I suppose I'm thinking about the professionals in particular, clinicians, social workers, whatever, and perhaps others who have a vested interest in the system and who have perhaps more of an awareness than the general public might of the particular financial constraints, for example?
Yes. Very often when vested interests are mentioned in the context of this bill, it's more in terms of community groups that are already quite empowered and already quite vocal, and the concern that there has been that we would empower the already empowered, and we've taken some steps to deal with that. But what you're talking about more runs to the heart of any kind of community empowerment, any kind of democratic debate. You know, they say that the first argument that is ever given for totalitarianism is efficiency. You know, you don't have to listen to anybody, so you get things done more quickly, but you get the wrong things done, and you end up with all kinds of side effects. We have to, as people in a democratic society, recognise that the partnership is there, recognise that you can mutually feed off each other, and that's something that's happening in health. The focus on patient-centred care is growing and growing, and long may it remain so. The era where the professional saw themselves as talking, as telling people what to do is long gone. And if it isn't long gone in parts of Scotland, it needs to go. But the role of the professional as facilitator, as interlocutor, as the enabler, and as the person who brings the specialist advice and guidance, that is where we need to be. And that, for representative Democrats, can be as much of an issue as for anybody else. But when you look at the role, for example, of parliamentarians right now, well, the role of a parliamentarian is very different to what the role of a parliamentarian was 100 years ago when we were in a very pure representative democracy. Back then, you saw your constituency when you got elected, and that was about it. And the idea of even holding surgeries and being available for members of the public was seen as something that was below Parliament. So we all need to adapt to public expectations, and that is something that we will probably have a bit of growing pain doing, but that's the great excitement that there is of change, isn't there? You have a little bit of difficulty doing it, but then the rewards are unlimited.
You said we've got to be an awful lot more responsive. Sorry, I'm Gary Coots from NHS Highland. We've got to be an awful lot more responsive to what individuals are looking for and the way that different communities want to react. And I entirely agree with that. But often that will be contradictory. So the individual within a community who wants to utilise self-directed support to get the services that meet their needs might actually be in conflict with a community organisation within their community who want to get that resource to be able to run a service that might be able to suit lots of people. Mm-hmm. Now, so it's more like playing in an avant-garde jazz band rather than an orchestra with a well-rehearsed score now. And that does mean that there will be variation in the way that services are delivered, which runs slightly contradictory to us looking for variation to try and make sure that we can weed out the bits that are inefficient. So I'm just wondering how much we can take our hand off the tiller and allow some of that free-flowing avant-garde jazz music to take off rather than looking to conduct the disciplined orchestra.
Yes, rather than avant-garde jazz, perhaps I would compare it to a script writer writing a play or doing it by workshop. And we should do a little bit more by workshop. My favourite play, Mary Queen of Scots Got Her Head Chopped Off by Liz Lochhead, was developed by workshop, by all the actors working together collaboratively. But that's a bit of a divergence. I think the issue here is that you can have communities that have competing interests. It's fairly clear, or communities that have competing interests with individuals, and that's perfectly reasonable, it's perfectly understandable. I have not a million miles away from here in my own constituency two communities that share the same space, but are two communities largely of interest that compete over things like land availability when things get brought up for development. That is where the representative politician, the decision makers, that's where all those structures come in. And there are issues. You know, you've got to be aware of competing interests, you've got to be aware of a lack of capacity in some communities, and there are some communities that might not want to engage as much as the most right-on facilitators want them to. All of these are the details that need to be addressed. They are not fundamental problems with the the approach, but they are things that everybody has to take into account as we move on. And in particular, the issue of the incentives around self-directed support is something that I will go away and think about, because the more that representative bodies are also service providers, the more there is a possibility for a confusion of roles there, and that is an issue that you wouldn't want to get to grow legs.
Thank you very much, and thank you for giving us the time for questions. As Mr. Biagi says, he's going to leave us with another film, but before he does so, can we please thank him in the usual way? We support a young man called Callum who lives locally here in Craigmillar. We've supported him for about 2 years now, and over the last 8 or 9 months we've worked quite closely with Callum and his mum and his extended family and network to try a different way of providing support, and that has been through an individual service fund underneath the self-directed support legislation, which of course came about through the national agenda to integrate health and social care more, which has been great, and it's worked really, really well. I think the things that we and the council would say as well have been the most important learnings that have come from this process are about sharing decision making, sharing control over the budget, letting go a little bit, being more progressive in risk taking. And I think just having an open dialogue and being able to be open enough to try things a little differently and see how they can work, rather than, you know, automatically shutting things down that may seem a little bit difficult or challenging or just hard to work out how to do.
Before you were 24-hour support 7 days a week.
Yeah.
And then you moved up to this house and you're on 27 hours a week now support, which is a huge difference for you.
Well, it was before I had staff all the time, and it just did my nothing, so...
Because you like your own space.
Yeah.
And there's a lot of things you do for yourself anyway. You don't need staff doing stuff for you, do you?
No, not at all.
You come back and forward on your own, don't you? You can do your own thing.
Just do my thing, yeah.
Yeah, and you've got lots of activities that you've got to keep you occupied.
Yeah. I like the team I've got now, because the team I had before was a nightmare.
Mm-hmm.
They didn't listen to me or didn't do anything with me. Just locked doors all the time and follow me about, and I hated it.
Callum says, and he'll tell you himself, that he used to feel listened to but not heard, and now he feels heard, and I think that that's made a difference, and you can see it in the changes in him.
You got, as part of your individual service fund, you wanted to lose weight and for your general well-being, so you got a personal trainer.
It gets me going, arms, legs, most of my tummy. I was quite a big guy, really big. I've lost about 3 stone. I've lost 1, so this is good. I'm quite proud of it, really proud of it. Got a 6-pack again. I got a camera for last Christmas and I got a good eye for it, someone told me. So I thought I'll take it photography and try it and see how it works. Kind of like taking pictures of the ocean or sunsets. Well, I've got pals coming on Saturday, just like for a wee night out. Give me a snooker and that.
What's your wee business venture that you're setting up?
Washing cars. It's going to be one business. I'm really forward to that as well.
A huge step from where you were even 8 months ago.
Yeah.
I mean, family can definitely see how much your self-esteem and your confidence has grown, and, you know, really proud of the things that you're looking forward to doing as well.
Yeah. Before it was a nightmare. Now it's kind of changing to an adult.
Regularly we get together and we have a chat about how things are progressing, and they certainly are. The multidisciplinary teams from the NHS, social work, very much the Thistle at the very core of that. And the good thing about Thistle is they very much brought me on board. If you don't have the backup of families, it's not going to really go anywhere. And obviously Callum, you know, Callum was so keen to move on, so keen to develop and be seen as a young adult in his own right. So yeah, we do all still meet regularly, we still evaluate what's happening and review it. And yeah, everything's great just now, so it's great.
Because of the changes that have happened with Callum and his support, he actually requires a lot less support. He used to have 24/7 support, a team with him all the time, and that was quite difficult for him because he doesn't like people in his space. He's been able to reduce that to 27 hours a week. The medication that he's on has greatly reduced over time, and the team are working towards helping him manage that himself. Callum and his mum Moira have been confident enough to actually go out and tell their story and talk to other people and talk to providers, go out and do wee events and things like that, that actually is sharing the learning that has come from this process. And I think that that's something that they're really proud of, and that's something that we are really proud of, because ultimately we want to be able to share this experience and help other people get the support that they need and be in control.